of experts. Joining us tonight is Jim Wahlberg. And I'd like to welcome everyone on Facebook, our viewers. KRQE has partnered tonight with the Rendon Group, the DEA Mark Wahlberg Youth Foundation, to bring you a special to talk about the opioid abuse problem we have in our state. Joining me tonight is a group of experts in this field, and we were just asking people out there that if you got to watch the special, or even if you didn't, if you know someone that's struggling with a substance abuse problem, if you want to help somebody, if you're struggling, here's your chance to talk to some of the experts, how to get help, or if you have any questions about prescription pills, please join us in this conversation tonight. Now tonight, joining me, we have a panel of experts. Joining us tonight is Jim Wahlberg, the Executive Director of the Mark Wahlberg Youth Foundation. Also, Dr. Larissa Malley, she's the Director of Clinical Services for the Addiction and Substance Abuse Programs. Dr. Brandy Fink, Associate Professor, Department of Psychiatry and Behavioral Sciences, and the co-convener of the UNM Substance Use Disorders Grand Challenge. Also, Kyle Williamson, he's the Special Agent in Charge, DEA El Paso Division. Jennifer Weiss-Burke, she is the Executive Director of Healing Addiction in Our Community and Serenity Mesa Youth Recovery Center. And New Mexico House of Representative Roger Montoya also joining us tonight. Here to start the discussion, we're going to start with Jim Wahlberg. And Jim, just first of all, you made a significant personal commitment to fighting the opioid epidemic. Why did you get involved in this issue?
You know, I got to be honest with you. That's my favorite question that I get when we do these events or when I talk in public anywhere. And my answer is really simple: is why not, right? We're losing hundreds of thousands of mostly young people in our country, right? Why isn't everybody talking about this and getting involved? It's really the question for me. But for my own personal life, my own personal journey, I'm a person in long-term recovery. And this epidemic that we're talking about, this opioid epidemic, which is really, for me, it's an addiction epidemic, was taking a chokehold on our communities. And I felt a personal responsibility to do something. And I wanted to add something to the conversation. And I planned on getting in. I made a film, to start a conversation. And I planned on going back to my happy life and my own recovery and my own family. And it's almost, I think, 8-9 years later, and we're still here. We're still doing this. We're still talking about this issue because the issue continues to grow and continues to get worse. So why not is really the answer for me.
And we really appreciate it. And you were really, part of bringing this to attention, bringing this issue and more attention to it here in New Mexico. And thank you for your role in helping us tonight, sharing your story with our families. Dr. Fink, this next question is for you. And we get this question quite a bit. Why is it that some people seem to develop an addiction to opioids faster than other people? And are prescription opioids safe?
Wow, that's really kind of a multifaceted answer to that question. We do know that just generally opioids hijack our normal brain reward system. So there's a vulnerability to almost anyone who's taken it for a certain duration. But we do know there are other risk factors that people have. For example, one significant risk factor is a history of adverse childhood experiences. Just being exposed to opioids as a young developing brain in adolescence, for example, and things like that.
Thank you, Dr. Fink. And we did get a question from someone that's tuning in on Facebook. And Dr. O'Malley, I'm going to ask you this question. What impact did COVID have on the surge in substance misuse?
So that's a great question. I'm not sure that I can answer for the whole state. I can say that at the University of New Mexico Addictions and Substance Abuse Program, we monitored that closely over this past year to see how it was going to affect our population. Fortunately, we didn't see a huge uptick in terms of increases in use or adverse events. because we managed to switch over to telehealth and provide services throughout COVID. So we're able to keep our patients engaged and connected to the services that we think helped to stabilize them. But what we did note was the increase in isolation had a pretty significant effect, both on their mental health in general, any comorbid conditions like anxiety or depression. And so I think we have yet to really see the full impact of COVID.
And on that note, we'll go to Representative Montoya. And what do you think needs to be done? Obviously, because we've had this surge, more services are going to be needed. And what do you think we need to do in New Mexico to address that?
Excellent question. As we emerge from COVID, we saw increases in the homeless population, increases in anxiety, increases in all sorts of stressors that have exacerbated this problem. For me, in the New Mexico House of Representatives, as a newly elected, the most potent thing we can do is address this from prevention and also education. I think long-term, the more we can do to train young families to be strong parents, the interventions as early as 1 to 3 are critical in the brain development as we move into pre-K and K-12 aftercare programs that are really vital. So many of those most affected are living in areas in our state that don't have access to services. And so I believe that the public school educational system is the most potent way to reach and provide those services of intervention. I've seen in Rio Arriba and Mora counties that are part of my district in northern New Mexico and northeastern, a severe increase in homelessness and co-occurring illness. It's almost overwhelming. I opened a shelter here, and we've seen an increase of about 25% in the last year. And so I hope I answered that question as clearly as I could. I'm just really overwhelmed as we emerge from COVID, and I think we have to address this through, again, prevention and educational strategies and interventions that will hopefully make that difference.
And thank you. And if you're just joining us on Facebook right now, I'm Jessica Gaddete with KRQE. We've partnered with the Rendon Group, the DEA Mark Wahlberg Youth Foundation. We brought you a special tonight about opioid abuse in our state and what every family needs to know about it. And joining us tonight is a panelist of people, experts. If you have questions out there, please feel free to put them on our Facebook page. We will bring them to these experts tonight. So if you have some substance abuse issues, if you know someone, you want to try to get them help, here's an opportunity for you to talk to the experts. So send me those questions. We'll be looking for them. The next question is for Kyle Williamson. He's the special agent in charge for the DEA El Paso division. And Kyle, why is the DEA involved in prevention and education? And can you tell us about some of the educational initiatives the DEA is spearheading?
Okay, well, we believe that you have to have a balanced approach. While historically DEA has been focused on reducing the availability of drugs, we do see a need to have a balance with prevention and education. The one thing that we have done is we have partnered with the Rendon Group and with our 360 program, where we get involved with the community in both not only enforcing the drug laws, but we also get involved in putting on programs to educate children. The one thing that we're doing right now is with Operation Engage that we're really pushing out in New Mexico right now is we're looking at going into the communities. And one thing I can tell you with 30 years in drug law enforcement, that for example, if you target the individual and you work with that individual and then you send that individual back into a home where there's prevalent drug abuse, then really you're not doing any good. So our focus with Operation Engage, for example, is to really go into the community. So it focuses not only on the individual, but it focuses on the community. So that's one of our biggest pushes right now is to go in, say, to a community, clean it up, take out some of the larger distributors, and then put in a good drug education program. and prevention program.
And Kyle, I have one more question from you from a viewer. Are officers administering Narcan more often? And how many officers carry and are trained in Narcan?
Well, that depends on the individual departments that are out there that are carrying the Narcan. There's a lot of different opinions on Narcan. When it should be used. For example, it can be while it's needed, it can also be very stressful for local police departments if they're getting a lot of calls to administer Narcan. It takes them away from maybe fighting more criminal activity. So, but it just depends. That's a lot, probably requires a long answer, but there's a lot of debate on Narcan. But yes, it depends on the department policies that are out there for that particular department.
Okay, thank you, Kyle. And next, I have a question for Jennifer Weiss-Burke. And Jennifer, I had the pleasure of sitting down with you and sharing your son's story. Everyone got to see it tonight. Your son died after he became addicted to opioids, and it was after a high school sports injury. And I think that really touched a lot of families' lives, because you get to see, I mean, as you explained in your story, that just a normal teenage kid who got into something that he really didn't know anything about, and neither did you. And now you've taken that and you've created you've created Serenity Mesa Youth Recovery Center, where you're able to help so many of our local youths here in New Mexico. And my question is for you is, substance misuse has destroyed many families. How can parents and families take care of themselves while helping their loved one?
Well, that's a really good question, and it's really important because it's a family disease. So everyone in the family suffers. The person that's struggling with the addiction suffers. The grandparents, the siblings. I mean, it's a family disease, and if you're not taking care of yourself, then how are you supposed to help your loved one? I mean, if your loved one, there's only so much you can do, but if your loved one is experiencing, if they want to get sober, or if they come to you and say, I need help, if you're not in a place where you can provide that help, it's very difficult. Or if you're constantly angry at your child because of the thing they have done during their addiction, it's very difficult. And so, there's groups called NARAN, which are family groups for family members of those who struggle with addiction. There's groups here in Albuquerque that you can find on the internet. I would say exercise is really important, meditation, mindfulness, all the things that we kind of advocate for on a normal basis for self-care, especially, and there's been a lot of self-care discussions during COVID for people that are struggling with just being at home and not being out and being social. But those things apply, all the time. And I think as a family member, had I have known those things when my son was struggling with his addiction, I would have probably been a completely different person. But I was a ball of stress. I was just a mess because I didn't know what to do or how to help him. And it impacted me severely. And I think, I could have been a much better help for him had I taken care of myself better.
Thank you, Jennifer. And I'm not sure if you can address this or if someone on our panel can, but we just got a question. It's a really good one. It says, I work downtown and I find it challenging to assist those in need. The community does not shut down at 5 p.m. Where do we go after 5 p.m.? Right.
Yeah, that is difficult. I mean, I run a treatment center and we do intakes during the day. We don't do intakes at night, but we do whenever we get a call for somebody that needs immediate assistance. There is the CARES campus, which is a detox facility that's run by Bernalillo County. They're open 24/7, or the hospital. I mean, we refer a lot of people to the hospital. Sometimes that's the best place, especially if someone's actively using. They could be at risk for overdose. They could have other mental that may need to be addressed. And so, going to the hospital where they can be assessed, and then care coordinators at the hospital can look at a placement for them, in the community or in New Mexico.
Okay, thank you, Jennifer. Anyone else want to add to that? Okay, thank you. I'm going to go back to Jim. And Jim, I know you've worked a lot with families dealing with the loss of a loved one to substance misuse. What advice do you have for families trying to manage this loss?
I don't know. Do you manage a loss of a loved one? I'm not sure it's possible. I know that the most powerful advocates for change that I have met, and the people that have been most fearless on the front lines of this thing, have been the parents that have had to bury their children. And when I got into this, I was just trying to, be part of a conversation. And now I know well over 1,000 parents across the country who have had to bury their children personally, right? And they have become my friends and my coworkers, if you will, in this battle. And I don't know, every Christmas, every birthday, every holiday of any kind, just dinner on a Tuesday night, there's an empty chair there, right? So I don't know. I don't know. People they're not going to get over it, right? But somehow they find the strength to get up and get out of bed and use their terrible tragedy to reach others, right? Because their message has depth and weight, right? When we as educators or law enforcement or even medical professionals, sometimes when we talk to people, it's like, yeah, that's your job, right? But when a parent who has lost their child shares their story, right? It has depth and weight. It's a different kind of a message, right? It's a message that I'm sure they would prefer not to be having to deliver, but their children will not die in vain because they will fight for other families so that other families don't have to have that same experience. So they're some of the most courageous and strong people that I know, and I spend a lot of time praying for them, to be quite honest with you.
Thank you, Jim. Mr. Williamson, I have a question from a viewer, and they're questioning where the drugs are coming from.
Okay. Well, right now, most of the drugs that come into the United States are and then into specifically the New Mexico region, all come from Mexico. Our biggest drug threats are methamphetamine, and the deadliest drug threat we have right now is fentanyl that's coming in from Mexico.
Okay. Dr. Fink, I'm going to go back to you, and I wanted to know, what advice do you have for people struggling with relapses, and how can families and friends support them?
Well, as Jen said, it can be super frustrating, and family members are often at their wits' end, but we have excellent treatments for substance use disorders, and just reach out. We have a whole host of things that are proven to be effective for people that can really help minimize slip-ups or relapses, give support to the family so that they can support their loved one in a very constructive and healthy way that, helps the family kind of get back together and start to enjoy their time with each other again. So I think if I can recommend anything, just give treatment a try, just give it a shot and see what it's like. It doesn't have to be a scary or terrifying experience. And, we treat people every single day successfully.
Thank you, Dr. Fink. We have a question from a viewer, and I'm going to open it up to see who could offer the best advice and have some advice for this person. It says, my brother is a homeless meth addict on the streets of Albuquerque, and there's not a lot of help for him unless they have income. Do our panelists have any advice for this person? Do you guys know of any programs that maybe could help him out if they don't have money? And Jennifer, we'll go to you.
I can add my 2 cents. We run into this all the time. Serenity Mesa is a youth program, so we provide services to youth age 14 to 21. So if he falls within that age group, we don't charge for our services. Our services are free. And we did that because a lot of people can't afford treatment, or they can't afford the co-pays, which was mentioned in the show earlier. So I would definitely have this person calls Trinity Mesa tomorrow, even if they're outside of that age group, because we can help them. We have a huge resource list and we help find people access to resources if they're outside of our age demographic. So they can call 505-877-3644. And we have a list of options that do not have a charge.
Thank you so much. And I hope that helps our viewer. The viewer just said he's 39. So I'm hoping
Okay.
that can help out and get him the help.
Yeah,
he
we
needs.
can definitely help point him in the right direction for sure. So just have him give us a call.
Okay. And thank you, Jennifer. Just checking to see if we have any other questions. I just want to touch base with everyone out there that's listening in, watching. We have a panel full of experts today talking about the opioid problem that we have in New Mexico. It's KRQE has partnered with the Rendon Group, the DEA, and the Mark Wahlberg Youth Foundation. So if you have any questions, put them down in our Facebook comments and we will get to them. Please let us know if there's any way we can help tonight. Dr. Malley, I was going to ask you, and one thing that I really learned through this special is just kind of changing how we think about addiction and why is it important to call this disease a disease rather than addiction? And that, I really thought that was something how we're shifting and trying to shift people's thought on this problem.
Yes, thank you. That I think the language that we use carries a tremendous amount of weight. And so really being thoughtful about the terminology that we use in discussing individuals who have a substance use disorder, thinking about it as a condition that does have treatment, like Dr. Fink was saying, very effective treatments, but also recognize that it is a chronic condition. It's something similar to diabetes or heart disease or asthma, that that we don't stigmatize individuals who struggle with those conditions, which sometimes can be lifelong and sometimes require multiple different treatments, both lifestyle changes as well as medications to really support their recovery. So I don't think we should view substance use any differently. And so really being thoughtful that we don't use terms that could be making them an other or making them putting them in a category to be stigmatized. So being just thoughtful about the language that you use to really see this as these are conditions that people are really trying to get better from, and not something that defines who they are as people.
Thank you so much. And this is another viewer question, and see if someone can pipe in and help on this one. And I know we've run into this issues with shelters, but this person is concerned because how do we get past people who have a problem having to be sober in order to check into rehab? It's a huge problem when they're ready to get help, and it makes things so difficult. And I know that's true with homeless shelters. You know, some of them you have to be sober. You can't be have been drinking or anything before they admit you in. I'm not sure if this applies with all our centers here, but can someone talk about that? Dr. Malley, is there someone that can talk to that problem?
Well, I'm sure other people can join in. My thoughts would be, I think this is just another artifact of not truly understanding the substance use disorder completely, and still having some stigma associated with the condition. Like I said, if we think about it like diabetes, we would never expect someone to start treatment with completely controlled blood sugar. So why would we expect someone who's struggling with opiate use or methamphetamine use to be completely sober before we would provide them medication or intervention? And so I think that unfortunately we're still trying to shift how we address these people and meet them where they're at, because like Jen said, I mean, we need to have services where people who are ready to get help can access that help, kind of regardless of where they are.
Yes, I would like to chime in a bit here too. It is absolutely essential that we have an opening for anyone coming off the street. At the shelter in Española that I helped to open, it is an absolutely low barrier shelter. You know, to take people who are actively using is difficult, but it is essential because it's a critical moment. You have a tiny window of opportunity to pull them in off the street and prepare them for what could be an opening to treatment. transitional housing, a whole myriad of services that are so critically needed. So the challenge there is that your particular setting has to be able to accommodate, crisis intervention. You have to have good coordination between law enforcement and emergency services. And it's not easy, but it is absolutely essential. I'll stop there.
Representative Montoya, thank you so much.
Can I add one comment
Yes.
to
Dr.
that?
Fink?
We've talked a lot about substance use disorder treatment of individuals who are really on the severe end of the spectrum of a substance use disorder. And really, I think we also need to shift our perspective, following up on what Dr. Mailey said, that it's incumbent upon us to identify these disorders and intervene before they've destroyed a person's life and the life of their family. And we are much more effective at getting somebody back engaged in their meaningful life if we identify them and get them into treatment much earlier. We don't have to wait until they, have identified as having a severe, severe problem.
And thank you, Dr. Fink. I'm checking to see if we have some other questions coming in. Representative Montoya, did you have something?
Sure. I'd like to say that in my experience, that some of the most effective interventions have come from certified peer support workers. Those who have lived this experience, are clean, 3 years at least, have the training and this power. It's incredible to watch. They have this ability to really lend a hand that can be trusted by those people impacted by co-occurring illness. And it's something that we should invest more in. It encourages people to emerge and recover and then be of service. It's been the most effective tool I have seen in Rio Arriba County, Española, Mora. It's remarkable to see in action.
And this goes out to all of you, and if someone wants to chime in, is there some more responsibility that the doctors could have? You have a surgery, you get, 30 pills of opioids for your pain and, oxycodone. Do we really need to be prescribing that much? Should we be looking at how much we're prescribing in the beginning? Because that's how, it gets into people's homes. That's regardless if you use all of them, then someone else can get them in your homes or your kids and so should we be looking at that, at how much we're prescribing?
I think so, for sure. I mean, my son got addicted after a surgery, and he was prescribed 30 Percocet, and I really didn't know. I mean, I wasn't given any education or any kind of, be careful with these medications. They're potentially addictive, that type of thing. And so I think educating the parents, I know when kids go to the dentist and have wisdom teeth pulled, oftentimes they're given prescription opiates for the pain. And a lot of times, we as parents, we just don't know that they are addictive, and we don't know, what to do. If they say they're in pain, we want to give them pills so that they're not in pain. But oftentimes we don't know that they only need those for maybe the first day or 2 days at the most, and they'll give you plenty that will last well beyond that. But sometimes we don't know that.
And then I'll go to Mr. Williamson on this, just talking a little bit about, what you can do, because you have a program that if you have these extra pills that you want to get rid of, what you can do with them, that you have a program to get rid of them. And then also, can you tell us a little bit of how easy it is for kids to get these pills right now?
Sure. I'd like to go back to that last question though, real quick, that, we at DEA, I mean, we've seen over the years where doctors have been over prescribing more and more and more. And I believe that doctors do need to be more responsible in how they prescribe drugs. And I think there's a philosophy in the medical community over the past few years that have been nobody should be in pain. And, at what point do we stop prescribing pills? And a lot of things that we do see out there, we see people dying and overdosing as a result of doctor overprescribing. So we DEA, we investigate that. We look at it very closely. We do monitor what the doctors are doing out there, and which leads into the medicine cabinet at home. And I'll give you just an example that, in a situation that we're in right now. So what most parents might have in their medicine cabinet will be oxycodone or looks like, and you'll see like a blue pill, they think it's Oxycontin. And that's the problem we have with fentanyl now coming out of Mexico. It's clandestinely manufactured. 2.2 milligrams of fentanyl will kill you. And on average, the fentanyl pills that they're called fake oxys on the street, they contain about 1.8 milligrams of fentanyl. And right now in DEA, 1 out of every 4 pills that we're analyzing in our labs throughout the country has a deadly dose. 1 out of 4 pills has a deadly dose of fentanyl. And what happens is these kids, they get into their parents' medicine cabinet. They take these pills that look innocent, that were prescribed by a doctor. They may take them to a party, put them into a bowl and have a mixer, for example. But then if somebody will bring the fentanyl they bought off the street, they look like oxys. And that's when you start having, our youth overdosing and dying at a party.
Thank you, Kyle.
And I'm sorry, I didn't answer your other question. We do. DEA has a take back program. You can go online and look at the DEA take back program, and you can find out where you can take the drugs that you no longer use, the prescribed medications, and you can drop them off at a location so they can be properly disposed of.
And with that, our time is up, and I just really want to thank everybody so much for participating, helping us out for our special, helping us out on Facebook tonight. Dr. Brandy Fink, Dr. Larissa Malley, Kyle Williamson with the DEA, Representative Roger Montoya, Jim Wahlberg, Jennifer Weiss-Burke. We so appreciate your time and all the help that you're giving all of our New Mexico families out there who may be struggling with some substance abuse issues, and thank you so much for bringing attention to this. The Rendon Group as well, DA Mark Wahlberg Youth Foundation. It's been a pleasure working with you. Thank you for everyone who's tuned in tonight on KRQE and on our Facebook page. And with that, I hope everyone has a good night. Thank you.
Thank you.